Hi class, good afternoon. Today we're going to be reviewing a mental health awareness topic in eating disorders. We're going to take a closer look at this infographic covering two different forms of eating disorders. In the United States, there is roughly 30 million people suffering from an eating disorder. Eating disorders have the highest mortality rate of any other mental illness. On average, every 62 minutes, a person dies as a direct result from having an eating disorder. The first eating disorder we will be reviewing is anorexia nervosa. Anorexia nervosa is an eating disorder where a patient severely restricts the intake of food. People struggling with anorexia may obsess over having a desired body weight, refusal to eat, restricting what they do eat, weigh themselves repeatedly, see themselves as being overweight even when they are underweight. Many of these patients and clients are at a very low BMI but still consider themselves to be overweight. Health risks for anorexia nervosa include thinning of the bones, anemia, brittle hair, brittle nails, low blood pressure. Patients even pass out, which is also a possible indicator that a client or patient is suffering from anorexia. Anorexia can also lead to brain damage, multi-organ failure, and severe damage to the heart. 3 myths that we will review are eating disorders are a choice, that someone could just eat and their eating disorder would be gone. That is myth number 1. Myth number 2 is, as a parent, there is not much I can do to help my child. There are many resources, treatments, inpatient, outpatient, step-down programs that parents can get their child involved in when they do discover they suffer from an eating disorder. Myth number 3 is that I would know if my child or teenager or loved one had an eating disorder. That is also a myth. The next eating disorder we will cover is bulimia nervosa. This form of eating disorder is when a patient or client consumes a large amount of food, which is followed by extreme guilt and shame. These episodes of eating large amounts of food are followed by excessive exercise, use of laxatives, vomiting, or use of diuretics. These behaviors can sometimes be used in combination. Health risks for these clients and patients include inflamed or sore throats, damage to their teeth, severe dehydration, acid reflux, and electrolyte imbalances. Eating disorders can affect all people of any age, gender, sexual orientation, or race. Diagnostic criteria that we use in the healthcare field is extreme low body weights, restrictive behaviors of intake, an increased fear of gaining weight even when the patient is underweight. And when a client or patient does not meet these criteria, they can also still be diagnosed with an eating disorder. Warning signs and symptoms: dramatic weight loss. A patient or client dresses in layers to hide the weight that they have lost. They are preoccupied with weight, food, calories, the fat they consume, and dieting. Refusal to eat certain food groups. They often develop rituals around eating, as in they tear their food into smaller pieces and separate them on the plate, or they have rituals where they eat their foods in a specific order. Excessive chewing. Oftentimes these clients and patients will come in complaining of abdominal pain, constipation, and an extreme cold tolerance. Sometimes a form of symptom would also be lightheadedness. They've passed out, dizziness when standing up. Treatment for anorexia and bulimia include multiple forms of healthcare teams coming together to help these clients into recovery. Patients may need medications for other coexisting mental health issues such as depression, anxiety, or other psychological illnesses. They often need nutritional and dietary rehabilitation, which will include a dietitian or a nutritionalist. Social and emotional support groups. There are various forms of inpatient and outpatient support groups for eating disorder patients. And then management of medical complications. Treatment for anorexia and bulimia include having a primary care physician, monitoring electrolytes, weights, blood pressures, heart rates. Now class, this is a brief overlook. This infographic includes some of the baseline information that is seen in eating disorder clients and patient populations. Thank you for reviewing this with me today, and I hope you guys have a great day, and I hope that you have learned more about anorexia and eating disorders. Have a great day.